So let's talk about menopause, how it impacts work, relationships, um, health, intimacy. As we get older, a lot of women feel overwhelmed,
Mm-hmm.
or weak,
Mm-hmm.
but they're not necessarily weak. They just may be overwhelmed. That's a lot. I mean, it's a huge transition.
It is.
I was talking to someone today about the transition between um, being young as single and then early marriage, um, getting pregnant, going through pregnancy, delivering after, and then now having your baby at home and a child growing, and how those are huge, especially from not being pregnant to pregnant, then from being pregnant to delivering, and then after, huge transitions
Mm-hmm.
for mental health.
Yes.
Because we think about the physical, but we do not think about like the mental changes,
Mm-hmm.
just not like how your brain is being rewired.
Mm-hmm.
And it's a huge thing. I was telling the kids yesterday, since I gave birth to them, my sense of smell
Mm-hmm.
is always alert, very
Okay.
high. So like when Lily walks in the room, but she hasn't showered, I know she hasn't showered.
Mm-hmm.
Um, and they say, "How is that, mommy?" I said, "It's just something God blesses mommies with
Mm-hmm.
after." So it's a huge change.
And when you talk about mental, it's a huge change. Um, I have a patient that has schizophrenia, and I was looking when I admitted her. I was looking at her medication. She has estradiol,
Mm-hmm.
and I'm like, why would she need? She must have a good person that get
Took care
on
of her, yeah.
estradiol. Yeah,
Mm-hmm. How old is she?
she's in her 70s now.
Okay.
So the physician that has her said, well, what is she doing with estradiol? She doesn't need estradiol. She's past. I said, no, leave that estradiol
Mm-hmm.
because she took it out. But when I saw it, I said, leave that estradiol
Mm-hmm.
there. A lot of women need hormone.
Mm-hmm. Mm-hmm.
We treat mental health with all these other medication, but I think that part of us that we're not producing anymore, we need to always have it.
Mm-hmm.
I don't know when science will come to that, but for sometimes when medication drops, we put it in the chart. Sometimes after a couple of days, or if it's programmed for 300 or something days, and the patient stays there for that, the medication can drop.
Mm-hmm.
So her medication dropped off
Mm-hmm.
one time. You need to come and see how she
When
was
the
acting
estrogen, when they
when that
stopped estrogen,
estradiol
stopped. Yeah.
dropped off her chart
Yeah.
because we renew it.
Yeah.
So it was not renewed by the PCP.
Mm-hmm.
So that's when I said, no, 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 I should just look and notice. I said, you need to put it back.
Yeah.
She became her normal self
Yeah.
again.
It's a huge, so that's a big effect on
Our
mental
mental
health. Yeah.
health.
And just like we were saying before,
Mm-hmm.
you know, you not saying that menopause caused the condition, but it doesn't make it better.
She's a
Yeah.
schizophrenia. I'm
Yeah.
just saying
And
it doesn't
yeah.
cause that.
Yeah.
But what I'm saying is it's a huge part of our mental
Yeah.
health.
And she needed the
So
estrogen.
when you stop having it, there has to be a process you will think of getting it back. What what is the need for you to think? Or because when we were growing up, when I offer to give estrogen to some of my patients, they say, no, I don't want cancer.
Yeah.
But why will you want to live your life miserable because you're afraid of what you're not going to have?
Yeah.
And research has not proven that people that have had it. Um, and I don't know if you remember Susan Summers.
Yeah.
She
She talked about
she talked about
the
how she
benefits of
the
estrogen.
benefits
Yeah.
of that estrogen.
Well, we're swinging to this side, I think, of the paradigm um, where people are having more comfort in talking about extending the use of estrogen
Mm-hmm.
for women postmenopause and not getting like hard cutoffs. Because and I'm impressed that
I
woman
had
still
I
had it.
had had cut off because when my surgery after the surgery When
Yeah.
the doctors gave it to me, they didn't even explain anything. It didn't help me.
Yeah.
So they said, don't worry about that.
About
They
taking.
stopped
Yeah, and
taking it.
that's the wrong thing to
But
do.
yeah,
Yeah.
they said, don't worry about that. Because I was giving the patch or something. They said, don't worry about that. So I didn't have anything. Then I was just off by myself and start researching. It affects friendship and some people, some women, I think, due to education. I have a friend that actually I was talking to her about dry vagina. She said, really? I don't have that. And she's
Your vagina probably is dry.
yes, I know. I said, stop lying to me. I won't call her name, but I know she cut her age by 10 years or something. But anyway, but she's older than me. And I said, you don't have it? She said, no, everything is fine.
Okay.
I said, okay. I said, but in case it's not fine, this is what
That
you
you
need
should
to
do.
do. She said, okay, when I did it, but it's so funny because another thing is women were in denial.
Yeah.
Yeah, we're in denial. We don't want to say that this changes because we want to be like 35, 40 or
Yeah.
something.
Yeah.
We
Yeah.
don't want to admit that as you get to 50, going on to 60, that your body is going to go through these changes, whether you like it or not.
So I wonder if you think about it then, how many friendships, marriages, jobs, and health would have not been on the decline or lost
Mm-hmm.
if a woman had started hormone therapy or some type of
Or,
therapy for brain chemistry
some
earlier.
type
Yeah.
of brain chemistry for early,
Yeah.
because I know religion does not encourage women to speak up about their sexuality. Remember, I'm
Yeah.
very active in the church.
Yeah.
And when you bring this up and try to discuss it, I still force myself to discuss it, you know. And I remember one time, me and the younger girls, because you know I always have younger friends that sometimes are yours age, because I want to bring them up. So me, what the doctor was, I told them we're going to. So one of them, I told them stand up and speak that we should be discussing this in the women's meeting. So she stood up and said we should be talking about sex and our husbands in the meeting. The pastor's wife did like this. And then the other one, I raised my hand. I said, I think we need to be discussing it when we come for Bible studies. We need to be talking about this because that's part of the Bible too.
What pastor's wife say?
Pastor's wife agreed. Finally, she agreed. But then we would discuss it and then she could bring some verse and all that. But
Yeah.
we started talking openly about
Yeah.
it.
Like why not?
About I encourage them about talking about buying good lingerie, all those things which the pastor's wife thought I'm crazy anyway. But I made the younger girls make her for us to discuss
Yeah.
it.
Yeah.
Because there are some of these girls, as well, some of them that are going through menopause, they need to know most of these things that's happening in your body. And all these women are in their late 30s and early 40s, and they pretend that it's not happening,
Yeah.
but it's happening.
Yeah.
That's one of the ways it affects
Yeah.
that. But there's no medication for that. I can't tell you how happy I was when you did my O shot.
Yeah. Yeah.
I was, and I was telling everybody, and people, I was telling
But the thing is,
everybody.
mommy, when you tell people, you're very animated in the way you have the conversation surrounding. So this is also coming from, um, obviously, experience with you and how you talk about things. And when you talk about sex, you're not, you're appropriate for the location, the age of who's there, but you're also very open about it, and you're very, and it's very straightforward. You're not. There's no innuendos. You're just saying what is, and I don't. They may just not be ready for that.
Yeah, but I tell some of these women, you don't have to be having sex. You just have to feel yourself.
Yeah.
Even the dryness sometimes. I told you one time I feel like taking my hand,
Yeah.
ripping it off.
Yeah. So that's exactly before we did the O shot. That's what you said.
I said sometimes I feel like taking my hand, ripping it off. So it does not have to be sex. You don't have to live your life just miserable.
Yeah.
If there's something that can help you.
So we did we did the O shot. I did the O shot
You
for
did
you,
OSHA,
which
yeah.
is PRP, platelet rich plasma, and it
Mm-hmm.
was because you were having very severe
Mm-hmm.
vaginal dryness,
Mm-hmm. It's not, I tell
postmenopause,
people
and
it's
the
not always about sex. It's how just feel yourself. Remember how you felt when you were. There was one woman when I was working here for you. She she was in her 70s,
yeah,
and when I went to go do her pap smear, I couldn't believe it.
yeah,
She's Italian by background, and I couldn't believe the speculum went just straight.
yeah.
She was not in pain.
She didn't have any
She did not. When I pulled it up,
atrophy or
there
dryness.
was
Yeah.
no atrophy. There was no dryness. There was nothing.
And remember what was she on?
She was on. She was on everything.
Yeah.
And that time you weren't doing. You were just doing. I don't know if you were doing.
We weren't pelleting at that
You
time.
weren't. You weren't pelleting, but she was pelleting
She from another,
from
yeah,
another place.
and she'd been doing it for years.
Years.
Yeah.
And she said, "Oh, I've always done this."
Yeah.
And I don't know if you started OSHOT. So I told her that we're doing OSHOT, and the price she was paying there was very expensive. Now she's in her she was at that time in her 70s. She might not even be having sex, but she felt comfortable
Yeah.
inside, and that's the part I like to sell to people. Um, you people spend $150 doing their nails, but you don't
People
want to spend money.
Well, I think a lot of times they spend more than that.
Well, for me, 150 is the people spend money doing a lot of things. You know, they spend money in their clothes, they spend money,
And this is how.
but you don't want to spend money to take care of yourself.
And then you also did the laser.
I did the laser. The laser is one of the best.
Yeah.
Um, when I did laser, you did the laser because I would just run straight to the bathroom
Yeah.
before I got there, and then you did that laser. The laser, of course, I always tell everybody, I don't feel ashamed telling them. I when they say they haven't that, I said, I don't have that issue. The laser really, really helped.
Yeah. Yeah.
In that part.
Yeah.
So there's answer for everything. And one of my friends said, I guess your daughter used you as a guinea pig. I said, no, she doesn't use me as a guinea pig. She helps me. I said, I pay her too. You don't think I'm not getting those things free, but I'm just telling you.
You pay me?
Yeah,
with love.
With love, I'm being your mother. So there's a whole lot that can be done, that you can do, that will help you. Going back, it's a question of, do you want to spend the rest of your life feeling sad, having a foggy brain, thinking that you have Alzheimer's but you don't have Alzheimer's?
You know what? That's
anxious.
Yeah. I had a lady say that to me the other day. I was doing a talk, and after I did the panel, she came up to me. She said, "I thought I was like getting early dementia or Alzheimer's, and I didn't realize that this may be a condition related to me being menopausal." And I said, well, you got to talk to your doctor first, right? You have to go see somebody, and at the same time, these like acute changes in the way you are functioning can be due to that lack of hormones.
It's medical. It's a chemical for your brain also.
Yeah.
It's like SSRI we use. It's part of those chemicals that you have to have all together in your neurotransmitter.
Yeah.
That you have to have.
You're not weak. You can just be probably overwhelmed with changes that are happening.
Overwhelmed changes. When you have the right thing at the right time, your body changes.
Yeah.
I know mine changed. I know I start feeling a lot better. And now that I'm in mental health, I know when I give people something, for example, that have ADHD, when they come back, they will tell me everything has gotten together.
Yeah.
And I'll tell them it's just not the medication. You also have to start learning how to do a couple of things so that you can keep up with time. And I have some that say my life is like day and night. when this menopausal thing, the hormonal thing that I did, it was like my life was like day and night.
Yeah.
I start feeling happy when you dress up and you go out there. All those things are things that um, you, you stop being sad. You
Yeah.
stop feeling like the whole world crying spells. You just stop having that. So,
I have been surprised at the amount of anxiety that comes along with it.
oh, a lot.
I was very surprised about that.
Hmm.
And there is, we don't talk about this enough. And I think this is not just in general that we don't talk about. I think medical practitioners, especially those who deal with women and manage menopause, we don't correlate enough the rise in anxiety, depression, and substance abuse,
Oh, yes.
um, addiction. We don't correlate that enough with um, sex hormone change. We don't
That's
correlate that
when
enough with
women
perimenopause.
start drinking a lot.
Yeah, because
Because
you're
that's
trying to
late
cope.
age.
You are
Hmm.
trying to cope. It is overwhelming,
And I see
the
a
changes that
lot
happen, and you're
of
trying to cope.
women because they use that alcohol to cope.
Yeah,
In the beginning, most women use it to sleep.
yeah,
And then by the time, because women's body is different than men's body, by the time they know it, they're dependent on it.
yeah, yeah,
And because I've worked here, when after treating patients, I always tell them, go to your GYN, let them run that panel about your hormones and see where you are,
yeah,
because you might need some to be added to your medications.
yeah.
Yeah.
What a difference we would have if we were open enough to talk about that and it wasn't as stigmatized because
It
um,
is still
and
stigmatized.
not just the sense of menopause, but what's stigmatized is that along with mental health and then the fact that someone needs help. They don't feel open enough to say, hey, there's a lack, there is an absence, and I need help. And I feel like I'm faltering.
Yes.
There is
And
that's
and
stigmatized.
also women are not supposed to discuss sex. Men are
Mm-hmm.
supposed to want sex,
Mm-hmm.
and they're proud to be having
Mm-hmm.
sex. So in fact, it's a badge of honor for a man. If you
Mm-hmm.
watch the ad for men sexuality,
Mm-hmm.
they have a woman by his side smiling like this,
Mm-hmm.
but you don't see many for women.
Mm-hmm.
Or women are supposed to not have that feeling.
Mm-hmm.
And it depends on the place, but down here in the south, you don't see them discuss it much. But it's a part of your life. It's a
Mm-hmm.
part, even if you don't have it anymore. Just even you and your partner holding hands, touching each other, you feeling happy within your relationship, all those things is like a package that you have, because you live this life only one time.
Mm-hmm.
If you all see anybody that have lived their home twice, you'll let me know.
Mm-hmm.
But you live one time,
Mm-hmm.
and every opportunity you get, you have to try to make it where it's worth you living.
Mm-hmm. Yeah, I think you're right. You're right.